lymphocytic edema. Edema means a swelling filled with fluid. Okay, so what is the point of lymphatic massage, guys?
Flows, lymph flow we can drain.
Why do we do it?
Remove the
toxic
toxins.
And
Bacteria.
help the immune system. Okay, to remove the toxic, which substance that lymph nodes release? What is
Filters.
called? No, what is called?
Lymphos. That's the name I forget.
What is the question again?
The lymphatic drain
Lymphocyte.
massage is done to remove the toxin from the body. We do it by releasing something. The lymph nodes will release something, substance.
Lymphocyte.
Lymphocytes.
Lymphocytes.
It's called lymphocytes. Let me just
Lymphocytes.
show you the picture so you guys can understand what I'm going. What
هي
I'm
غدد الليمفاوية.
Symptom.
الغدد الليمفاوية وكلمة الليمف and lymph nodes are two complete different things. They are not the same thing. Okay? You are working on the lymph nodes. Why? Because you need to have your lymphatic system. This is all lymphatic system. The lymph and lymph nodes are completely different things. They are not the same thing. Okay? You will understand now.
What is the two types of it, sir?
Lymph? No. Usually when people talk about lymphatic massage, they think that lymph and lymph nodes are the same thing. They are not the same thing. Lymph and lymph nodes are the goal of your massage to specific places. Okay? In the upper part, you are going to take the toxins to the axilla. In the lower part, you are going to take the toxins to the groin area. This area. This area. Okay? So, some people prefer to start on the neck, then on the head, then chest, then go up. Okay? The easiest way is to divide. This is the head. Divide the head into three parts. The fourth head, this is the first part. This is the second part. This is the third part. Start from the first part, then the second part, then the third part. Take the toxins down and not on one side, on two sides. Then take it to the, what do we call this place?
By subtrainer
Someone forgot. This is called mandible. This is called sub. Sub means under. Sub means under. Take it to the submandible, then cervical. Okay? Then down to this area. Then go up on the chest. Okay? Then take it all under the armpit. Then go to the front. Do the same thing until you reach the axilla. Now, if you want to do the lower part, you are not going to start all the way. You are going to start all the way down. Start from here, from the thighs. Do the upper sides, then turn him over. Do the back side.
Where? Start from
Because the knee will need too much work.
How about the pressure is light, sir?
Yeah, very light touch. I will show you how to do it. The one that we need you to focus more is the area surrounding the knees. It's not easy. Okay, we'll spend time in this area.
طيب أنا بالنسبة لي يا دكتور I do massage in the knee.
How many minutes?
I send the lymphatic here under knee because it's half also here غدد
Do
الليمفاوية.
the look away under here. So we're going to work on the front side, then the back side.
اوكي أنا بطلع من هنا وأنزل على هنا وبعدين أطلع
You
من
can,
هنا.
you can do that. I like to take it to the groin area. Then when I do the lower part, from the back side. But it's easier to get it to the groin area first. The session can be between 15 minutes to 60 minutes. The one session. 15 minutes to 60 minutes. 60. Okay? So, did you get the water? Yeah. Too fast. Give me water. Before you start the session, give the patient
After session?
before and after.
Where's my coffee?
Yummy.
Okay? So, you remember what we talked about? Medical history, how to take the medical history?
Sir, you have infection, you have
No, this is not medical history.
question.
I
I will ask you, and you
Mm.
answer. If you don't want to answer,
Pregnancy.
honestly, it's okay.
Mm.
Just answer me. Okay? First, I will take something called personal information. This is before he even lay down. Okay? What's your name?
Name
How old are you?
40.
What's your nationality?
Indian.
Religion?
Jewish.
Do you have any allergies?
No.
Okay? This is called personal information. Now, you will ask about surgeries and medication. Do you take any pills, any type of medication?
Yes.
What is it?
Birth control.
Birth control?
For example, she's
No, I mean, it's example. No, I mean, I
She's
don't
a
know.
girl.
No, it's I have arthritis, so I'm taking for my urine
What is the dosage you're taking?
500 mg
Okay, how long have you been taking?
for 2 weeks now.
Okay, ask about the medication he's taking, ask about the dosage he's taking, ask about how long has been he taking. Okay, the whole point of medical history is we're trying to eliminate some disease, some disorders. Why? Because we will not ask him directly, do you have blood pressure, do you have diabetes, do you have heart problems? Because why? He can lie. And lymphatic drainage massage have a lot of contraindication. Okay, this is why it's important to take medical history, especially in lymphatic drainage massage. You finish the medication, did you do any surgeries before?
No.
If you said yes, ask what type, when did you do them, and did you feel any side effect after doing the surgeries or not? Okay? After this, if you want to ask, you will have to ask about disease, but don't ask directly. For example, if I want to know if he has any respiratory problems or heart problems, I won't ask him directly. I will say, do you have shortness of breath?
Sometimes.
Sometimes. Okay, can you describe it?
Sometimes when I'm running after that shortest or like I'm really tired.
After you run and you get the shortness of breath, do you feel like you're about to pass out, or it will go after a while? It will go. So this means he doesn't have any heart problems. Okay. Do you have any tachycardia when you lay down? Do you feel like your heart beats too fast when you're resting?
No.
This is also mean he doesn't have any problem. Do you get shortness of breath in cold weather, or if you're playing in dust or something like that?
Yes.
This can be an indication of asthma.
Yes.
Okay. Is asthma contraindication or normal or lymphatic massage?
Normal.
Normal. It's not contraindication.
Yeah.
Asthma is not contraindication. Okay. In asthma, you will need to watch one thing: the posture, because asthmatic patient should not lay full down. Asthmatic patient should be up a little bit upright like that. They should not be laying down. If they lay down like this, there is a chance they can get something called asthma attack. Okay? Do the same thing. Ask, do you have any dry mouth? Do you drink a lot of water? Blah 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 blah. Just try to eliminate diseases. After finishing, if everything okay, you will continue. If there is some problems, you will not do the session. What are the contraindications of lymphatic drainage massage? When we will not do lymphatic drainage massage? If he has surgery, what else?
Pregnancy.
If he has the reason for we are not going to do it if he had surgery, because during surgery the lymph nodes will be damaged. In case of pregnancy, only in first trimester we are not going to do it. Other trimester is fine. Wait until wait until 5th, 5 or 6 week, 6 months, then do it. What else? Influenza. Why? Because usually when someone has influenza or flu, their lymph nodes will swell a little bit. Second, fever. Why? Because your body is fighting an infection. Right? Next, if he has cancer, if he has any problem with the immune system. What else? If he has any type of transplant, organ transplant. Even he did the surgery and he transplanted and everything okay, you still won't do it.
Varicose. Varicose.
Very what?
Varicose. Varicose.
Varicose vein?
No. Any
It's
type
okay, no?
any type of organ transplant. Also, if he have any heart problems, myocardial infarction, heart failure, valve dysfunction, anything.
Like
How come if he feels heart palpitations?
Depends. Then you will know if it's from a severe problem or yes no. Okay. Yes no about the contraindication.
High BP,
High BP no. No problem.
low BP also.
Low BP no. Low BP is a contraindication. High BP normal. Hypertension contraindication. Okay. Do a complete medical history. Figure out everything so you can know if your patient can do the procedure or not. You will not allowed to use any oil. You are not allowed to use oil in lymphatic direct massage. You are not allowed to have any back noise using white noise stuff like that. It's not allowed
What is the reason, sir?
because you need to focus.
Ah.
So only dry massage, how we can?
I will show you now how to start the procedure. Okay? Everything is okay. Get me the last bottle. Usually you will have like a cotton or something.
Sorry.
Enough. You have not the tissue, of course. You will have like cotton or something, right? You will start washing the place you are going to work.
Grabe naman ito makatutok.
With the brush.
Sa mukha ko.
After washing the place, the skin is dry. And in lymphatic massage, you are not going to use force. You need your hand to go smooth. This is not smooth. So, in most cases, you will use lotion. Why? Because oil is not okay in lymphatic massage. But we don't have lotion, so I will use a little bit of oil, not much.
You can use the lotion, no?
Yeah, you will use lotion immediately after you wash. You will use lotion.
oh, sarap. Wow.
Babata ka nun. You'll get younger after that.
Focus on the places you are going to do. You are going to work on. Repeat the procedure 2 times. Again, tissue. Again, lotion. Okay. So next, divide to 3 places. 1. The forehead is number 1, all the way till the eyebrow. Number 2, all the way to under the nose. Number 3, this area around the nose. Okay. So you can start from 1, 2, or 3, or 1, 2, 3.
This
But
one.
you are not going to go down. You are going to go to the side. You are
Side.
going to take all of the toxins. Imagine if you're sweeping the floor. Okay, you are taking the things you swept here, right? Then collecting from here, then take it down. Then collect from here, then take it down to the side. Then submandible, then cervical, then get upper chest, then take it to the
Armpit.
axilla.
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 Okay, how much force are you going to use?
Very, very
Light.
light.
Light force.
Why?
Because only in
Because
the
it's
the the what's called that one?
No, it's
It's on the
only
in the skin.
The nodes in the skin only.
No,
الوش وزي الصدر وزي
No, yeah, but also remember that the lymph nodes is under the skin.
Yeah.
It's not
That's
it's
right.
not like muscles.
Not
or
deep,
like
no?
that. It's under the skin, so you are not going to use too much
It's
force.
very light.
Okay, are you going to work with your full hand or fingertips or thumbs?
Fingertips.
Fingertips.
This one.
Fingertips or
Fingertips and like this.
Thumb.
Thumb.
either your fingertips or your thumb. You are not going to use your full hand.
Yeah.
Okay, so I want to start from this area, right? What is the direction I'm going to follow?
Sideways,
I'm
sideways.
going to go to take it
Sideways.
down,
Yeah.
down.
Down.
Okay, Yusuf, Elfi, you guys sit and do like I do. Come from this side, please. or just sit in this side. Sit in that side. Okay.
نعمل ايه؟
Sit. Take the chair on this side next to me. And one of you will be the patient, one of you will be the doctor, and you will do as I do.
Same here as here.
If you want, yeah. But it's better to watch than do.
Yeah.
Watch first.
Okay?
turn
Guys.
around, give me your back. صح؟
Now you are here.
And the patient? Water.
Make sure when you move your fingers or you try to move your arms, it's smooth. It moves easily. It moves easily. Why? Because if it's dry, you will have to use force.
Yeah. You could.
See the areas in white color? These are the areas you are going to take the toxins to. Okay? Hurry up, guys, so we can start. Okay, so we divided the first place, right? So we want to start. We can either use fingertips or thumbs. In this case, which one do you recommend?
Thumbs.
Thumbs. You go. Watch the force I'm going to use. Same force. Give me your hand. Your hand is too dry. Right? You are going to use very light, very gentle. And you are going to use slow motion. You are not going. You are,
Bro, gentle.
I'm not gonna do it like this.
Harder.
This is bad. I'm not gonna do like this. No. Slow. Imagine yourself sweeping. You're not going to sweep too fast.
Imagine I am your girlfriend.
Kidding, Alfie.
Already sleeping, very.
Quickly sleep.
Don't be in a hurry. You have all the time you need.
Yes.
Don't be in a hurry. You have all the time that you need. Don't try to do it too fast. Don't try to think that you don't have time. Don't try to rush the patient, especially if you have other customers. Take your time. This is a slow procedure. It's not a fast procedure. This is slow procedure.
Okay.
How long should I stay in this area?
10. I know
You
10.
said the
If-
times.
No.
No. In this area, I want to do like
How many
for
minutes?
example, I want to do the head, the arms, the chest, the stomach. How long should I stay here?
2 minutes?
10 minutes.
No.
2 minutes.
No,
No,
5
five.
minutes.
No, 5 is too long.
3
Three.
minutes.
2, 3,
2 minutes.
less than 5 minutes.
For the full face.
No, not the full face. If
Only
if I
the
want to do the
forehead?
face,
Ah, yeah, because
neck.
it's too much.
the arms, and the chest.
So if only, face
Only
only.
5 minutes is too long.
5 minutes in here.
No,
is
no,
too
no, no,
long.
no, no, no.
No, not
10
full.
minutes.
Full face, 5 minutes.
Full face can be like 5 minutes.
Oh yeah, full face 5
No,
minutes.
sir.
But if I want to do the full face, here, and the hand, and the chest.
20 minutes?
No,
Maybe.
like maybe 15 minutes.
15,
15
okay.
minutes. This is why I say you have all the time that you need. You don't need to rush it. Lymphatic drainage massage is not a normal massage. Patient can die.
But we need to practice whole
Patients
body
can die.
come inside the 60.
أنا دايما لما بعمل مساج الوش ببعت كله على هنا.
And you are going to take it down to the submandible area.
ورا الودن بالظبط.
No, submandible. 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 How many lymph nodes you have in your neck?
الغدة الليمفاوية أنا في كتير أوي.
If your body has 700, if I'm saying if if your body has 700 lymph nodes, your neck or your stomach will have half of them.
350.
350.
Your neck or stomach or the abdomen area, the abdomen area or your neck will have half the lymph nodes in your body.
Off.
Half of them.
The 700.
So
Half of
300.
them. So, from the face all the way to the chest and under the armpits, this is important. The areas pointed in white color are the areas you are going to take the toxins to. For example, the upper body, you are going to take the toxins to what?
To armpit. No, axilla.
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 To the thighs, stomach. Where are you going to take the
Growing part.
bottom feet and lower feet? Where are you? And you're going up. Where are you going to take
Here.
it? Yeah, behind.
Yeah.
Okay. So let's say we finish from this place and we want to start here. What are the places we are going? What are the places we are going to work on in here?
Sinus. Frontal.
Alfie, can you pass the slides? Go down, go down, go down. Down, 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 down. Very down. Keep going. Don't stop.
Yeah.
A little bit up. So, where are you going to start from? Sides.
Side of the nose.
Side.
Sides of the nose. Go to the next one. Then where are you going to go?
From the mandible.
Above the
Side
nose.
to down.
Chin.
Here.
The chin.
Then
Below the mouth.
from here, where are you going to go?
For the
Down.
Down. Cervical. Sub.
Then,
Submandible.
Submandible.
because in the neck you have two important places. Number one is called submandible, which is underneath your mandible. Next one is called
Cervical.
cervical, which is in the side of your neck. Okay, so if I want to start from, this is the first one. If I want to start the second one, I'm going to start sides of
Side
the
of
nose.
the
Side.
Okay, am I going to use my fingertips or my thumb?
Fingertips.
Thumb.
Thumb.
Thumb. Yosha.
دكتور أماكن الغدد الليمفاوية اللي هي أماكن الانسداد دي كلها اللي هي تحت الركبة تحت الكوع أندر أرم كل ده أنا اللي أعرفه واللي بشتغل بيه إن أنا ما بعملش في المناطق دي مساج أبدا.
لا هي مش مساج. الليف نودز it's called lymph node drainage massage but it's not a massage.
أنا لما باجي أشتغل في البادي مساج ما بشتغلش في الأماكن دي خالص.
أحسن.
صح كده؟
صح. Guys, lymph node drainage massage it's not a massage. Don't think of lymph node drainage massage as a massage. It's a medical treatment. Any medical treatment has side effects. It can be good, it can be bad. In this case, the things that can happen to your patient are severe. So you need to
Carefully.
work slowly, focus, don't rush it, use the right amount of force, and know every little detail about your patient before you start. Okay, so you awake?
Oh.
How long should I do this? For how long?
2 minutes.
2 minutes.
كم دقيقة? The easiest way, for me personally, the easiest way, 2 minutes, 2 minutes, 2 minutes. This is why I say don't rush it. You have 120 seconds to do just one part. You have all the time that you need.
The facial there is doing like a 30 minutes.
If only face,
Only face,
30
facial.
minutes, 30 minutes for only face is too long.
But there are skin clinics.
You can do around 20 minutes for
Last-
the
last.
whole face.
But I will make a hydrofacial, sir, is 1 hour.
Yeah,
Because they have
not
steam.
Not 1 hour massage.
Yeah, because this
It has
steam.
steam,
Yeah,
mask,
yeah, yeah,
lot of
yeah.
steam.
Everything.
Speaking of steam and stuff like that, what is the best thing to do after finishing?
Steam. Ice.
Ice what?
Ice,
After finishing the whole session?
Ice. Apply.
Ice
ice,
bucket.
ice.
Would you?
Good
Cold,
you
cold
do.
surface.
Ice, like
Yeah,
this,
yeah. Why we apply ice? Some people say ice bath. No, not ice bath.
To reduce the flow
No, it's
of
not.
to reduce the
The-
core temperature of the body. Why? To make the circulation gets back to normal. Because while you're doing the lymphatic drainage massage, the circulating system will change. The flow will change. We apply, for example, if you have cold, what do you call it? The thermal packs. The cold thermal
Thermal
packs.
pads.
You can just put 1 or 2 on your patient's chest or stomach. The cold will lower his body temperature and will make the circulation gets back to the normal.
So we apply where we massage all
Just
only
put-
some
just
place.
put one- Just put one pack.
Chest, sternum. Oh.
Don't do ice bath. People think ice bath after lymphatic massage it's okay. Don't do ice bath. Don't do sauna. Don't do steam.
Only cold.
You need something cold to make the body temperature, the core temperature drops.
Drops.
So the flow gets back to normal. Okay, so I finished 2 minutes here. Where would I start in this place?
Down.
Here.
And
Down
what,
off.
what is the direction I'm going to take?
Downwards.
Go down side.
Going to
Down
sub.
to where?
Going
Down to
Cervical.
submandibular
Going
cervical.
Sub.
Subman.
Yeah, okay. This is important. Okay, let's say I started, I finished, I reach here. Okay, what is the direction? Can you turn your head? I reach this place. Will I go here or here?
No, that way, sir.
Side.
Side.
The easiest way, follow. Do you see this bone?
Yeah.
Follow this bone.
Going to
Going this way. You will feel also when you are.
circle.
Yeah. Do you see this bone? Follow this bone. Then go down.
Turn down.
Follow this bone.
Go down.
Go down.
At a time we can do the both side or one side only.
Don't use your thumb in here.
Yeah, only fingers.
On your fingertips.
Use it. Some love. Use your fingertips. Because I'm using lotion and real life use lotion. You can wet the area with like water and cotton or gauze. Make it very wet. Then apply lotion.
حتى لو زيت طبيعي مثلا زيت
Lotion. Don't ask me what I.
Sir, every time you do, you put first the water or cleansing and then
Yeah,
after
because
the lotion.
because usually try it at home.
Okay.
Like rinse your hand with water,
Yeah.
then apply lotion. It will
Ah.
become slippery.
Okay.
This is the only reason we're
بس
using.
بينشف بسرعة
Hmm?
بينشف
أيوة. You have to do it. You have to before you when you first do it, we'll do it 2 times. Water, then lotion, then water, then lotion, then start. This is why you can't stay too long in one place. Why? Because it will get dry. Okay. So I don't use my thumb in here.
Fingertips.
I use my fingertips. I can use, for example, 2, like I'm doing examination, or I can do all. I prefer 2. Let's say I took it all down here. Okay, 2 fingers.
Parang si Alvin ng ano eh. Puro
I need the full massage. How much to charge?
I charge 5,000 dirhams.
Yes, 2 gives.
tabi.
5,000 dirhams or chocolate.
They have
The easiest
tabi
one.
or tamara.
Then turn your head like this. Let's say I reach here. Where to next?
Next down.
Down here. Okay.
Down, yeah.
Will I use my thumb or my fingertips?
Fingertips.
Fingers.
Finger, 2 fingers. I use
بالنسبة
go.
لي عادي أنا ممكن أشتغل
Fingertips easier. In thumb, it's hard to manipulate
Yeah.
because in lymphatic drainage massage, not the most important point, but something very important is called manipulation.
Manipulation.
Manipulation. If you try your thumb,
No, no.
You enforce.
it's hard to manipulate. But if you try your fingers, it's
It's
easy
easy.
to manipulate. Okay? So guys, you don't need to divide your neck. Okay? Just get to this point, then follow this point, go all the way down until you reach. Can someone
Only
slide
the left
on this?
left side, sir.
No,
Only
no,
to the
both
right.
sides,
Both
sides,
side.
okay?
Okay.
When you reach this area,
Okay.
go to the next one. Elfie, slide.
The slide. The
Slide. The chest. Chest.
chest.
chest.
Yeah.
So you will go up.
Up.
Is it thumb or fingertips?
Thumb.
Thumb.
Fingertips.
Fingertips.
So we send all that here,
Mm.
and then we leave it here, and then we
Get
start
this
from
one,
here
And
until
together,
Okay.
imagine yourself sweeping the floor. For example, you sweep this part and you collected the dust in here. Then you will go to sweep this part, and do you leave the dust there or you bring it all together?
Okay.
I'll bring it together.
All together. Why? Because you need to take it all to the
Drain.
To the axle.
axilla.
Axilla.
Okay? So, is it thumb or fingertips?
Thumb.
Finger.
No, no, thumb. Thumb in here, thumb.
Going up.
Ganun kabagal.
Where would you start in the chest? What is the best place to start?
For the
The end of the
upper
chest.
abdomen.
Upper
Ribs.
chest.
You see the nipples?
Yeah.
Under the nipples in the middle.
Nipples and middle.
And here, here.
This is the nipples.
Yeah.
This is the middle, a little bit
Okay.
lower in here. So, just because I started here doesn't mean this is the right place.
Okay.
اللي هو تقريبا اللنفس الصدري من عند أوله كده.
Yeah.
Sacrum.
So, I took all of it there. So, what's the next step? And how long should I stay here?
Like 3 minutes.
1 minute.
No, no, no.
2 minutes.
No.
5 minutes.
5 minutes.
No, maybe like 3 or 4.
3 or
You are
4.
going to
3
stay.
or
You are
4.
going to stay more than you stayed in
Two,
this part.
2, 2,
and then
2
three
and
or
extra
four.
1, 3.
Okay. So I collected all of the toxins here. Where to next?
Take into the axilla.
Same
Axilla.
to the axilla.
Going to
Axilla.
axilla.
How about the other side, sir? 2D?
No.
This
Sa
one.
gitna
It's
lang,
only
ayan,
here, like
Yung
this.
the arrow.
By the way,
Hmm.
because you did the front part, does it mean that you will skip? Because behind the arms, you have also behind the arms here in this place. Some people say do all the front part, then do all the back part. This is wrong. This
The
is
same
wrong.
time only we
No,
can
no,
do.
this is wrong. You do the full upper part,
Hmm.
front and back. Then divide your body into 3 parts: upper, middle, lower. Do the upper,
Hmm.
do the middle, do the lower. The upper do front and back. The middle front and back. The lower front and back. Don't do all front, then turn
Back.
around, do all back. This is wrong.
First upper, then back, and middle, upper and back, and down, middle
In
and
the upper part, you will collect all the toxins in the axilla.
axilla.
In the middle, you are going to collect it in the groin.
Grow part.
In the lower, behind the knees.
Behind the knees.
Okay. So, in here, would I use my fingers or my thumb?
His fingers.
Fingers. I will use my fingers. I prefer 2 fingers. Like all this. I like to do with 2
Can
fingers.
you take off the t-shirt, please?
Yeah.
Yeah. Better.
Remove your t-shirt.
Sleepy, bro.
You're still alive.
I want to sleep, bro.
Take off your shirt.
2 fingers. Some people like to use 4 fingers. I like to use 2 fingers.
Yan, dahan-dahan pa ulit-ulit. Making
So-
slowly and
No, no.
repeat.
Look at this. I started from here, right?
Yeah.
Then I reach here. I
Yeah.
did it a couple of times.
Yes.
3 or 4 times.
Yeah.
Now, if I want to go down more, I won't start from the same place. I will start a little bit further. Then I will go further, then further, then further. Then if I want to start again, I will go a little bit then further one more time, and like that. Okay. Where I'm going to take it? Where am I going to take these toxins?
Must be here.
Going here.
Why? Elfi, go 2 pictures above.
Line is here, no?
Until I say stop.
Here also.
No, no, above. Above. Lower. Above. Yes. So, is it easier to go like this or to go down?
Go
Which one
down.
is
To
easier?
go down,
is
to go
best.
down.
But for me,
No,
it's
here.
here like this.
This is the easier
Yeah.
because if you decided to go down.
دي أطول.
It's not just longer. It will take more time.
أيوة.
More time.
But easiest way.
More time. It's easier to go like this. Okay. So if you want to remember the direction you are going, you started from the top, right? You went like this. You reached this bone, you turn to the left. Then you went down. You stopped here. Then you came all the way up till here. Then
Down easy.
like a highway. Like a highway. So why do we stop at the axilla?
Axilla, we have
Because
the
that is the exit of
point.
The area of
the
drainage point.
The
Drainage
open
point.
drainage.
that is the drainage of the
filters.
عشان في الوجد
أكسلة.
الفوائد الكبيرة اللي هنا اللي هتعالج
Lymph nodes.
السموم وتخرجها بره الجسم.
Okay, if the lymph nodes fail to absorb the fluid from the main lymph, what do we call this?
Lymph. It's like a
lymphatic.
If the lymph nodes fail to
absorb.
absorb 40% of the fluid in the main lymph, what do we call this?
We have the
Lymphatic
size.
drainage massage.
No. We have fluid like what yesterday that is 2 centimeters.
You have your
Oh,
main
my.
lymphs in here, right? The main ones. This is why you take the lymph node to take the toxins here. Okay? So if you have a main lymph node, a main lymph, and the lymph nodes, one of the jobs of the lymph nodes is to absorb fluid. If the lymph nodes fail to absorb the fluid, what do we call this? What will happen?
يعني لو هي مش فاهم اشرح لي.
it will become
لو هي مش بتصرف سوائل
This is your main lymph node. Inside of your main lymph node, fluids will start to appear. Okay? One of the important functions of your normal lymph nodes is to absorb 40% of this
Of
fluid.
the flow.
بخلص من 40% من السوائل.
تشفط 40% من السوائل اللي جوا النودز. Okay? If this procedure fails, what will happen?
سؤال
Yeah.
What do we call it?
Sweating.
What do we
Edema.
call it?
Edema.
What? You can't say just edema.
Swelling.
Edema what?
swimming blessed
Nodes.
Edema nodes.
will become
Lymph.
lymphatic
Lymphatic edema.
yung magbukol-bukol
Lymphatic edema.
Lymphostatic edema.
Lymphatic.
Lymphatic edema.
حاجة أنا كنت بكلم حضرتك عنها تقريبا.
Lymphostatic edema. How bad is this?
It's very bad. It's
huh?
How bad is lymphostatic edema?
It's very bad. You have to
He
sink.
die.
No, he won't die.
cancer.
Open.
I will get
The swelling-
produce of cancer
Cancer.
produce of cancer
Toxic.
Cancer cells like that, no?
wait very bad yeah
And you have lymphatic edema. The case of
Cause of
edema
edema
lies
is
chemical
lies
imbalance.
chemical imbalance.
So,
Lymphatic
this is not the
edema.
only cause of lymphostatic edema. Lymphostatic edema can happen in
Decrease.
so many different ways. Surgeries. What do you mean by chemical imbalance?
Chemical imbalance.
Dehydrated.
heartburn
High protein,
No, no.
high sugar,
Decrease.
Chemical imbalance happens when the capillaries pressure
Pressure. Decrease.
very high,
Decrease.
increase.
abnormal. I
Abnormal.
can't remember if it decrease or increase. Increase.
Permeability.
So, when the
Increase.
capillaries, do you guys remember what are the capillaries? Because we said in the cardiovascular system we have three: veins, arteries, and capillaries. Okay? If the capillaries pressure increase, there is something happening. It's called chemical imbalance in your body will happen. If this happen, it can lead to lymphocytic edema. It's not only, you can't only find it in here, you will find it everywhere. Okay? When will you know if this is lymphocytic edema or something else like cancer?
We can see the lymphatic edema,
Please
the
focus,
size.
because you sometimes you might have to deal with something like this. If the swelling, this is the swelling. Like if I'm touching a swelling in here, okay? If I found a swelling, this is the swelling I found. I will push down. If it's soft, I will worry a little bit less. Okay? If it's hard, I will start to worry. Okay? If it's, guys, focus, please focus. If it's hard, I will start to worry. Then I will try to move it with my finger. I will try to use my finger to move it. If it moves, I will not worry. If it stays, then this is a problem. Finally, the size.
1
Is
centimeter.
it larger than 2 centimeters or smaller than 2 centimeters?
Smaller.
If it's larger than 2 centimeters, this is a problem. Because lymphocytic edema, 2 of them can be smaller than 2 centimeters. 2 lymphocytic edema can be smaller than 2 centimeters. If one swelling is bigger than 2 centimeters, then this is a problem.
This is the problem.
It might be
Malignant.
Malignant.
because lymphocytic edema has 3 classifications: either malignant or
Benign.
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 Either secondary or primary. هوريك. Either acute or chronic.
Chronic.
Acute chronic.
These are the classification of your lymphocytic edema. If you found lymphocytic edema, you will have to examine it to determine which one of these is your lymphocytic edema. Malignant means cancerous, probably. Benign means it's not cancer.
Okay.
Secondary and primary usually depends on the size.
Okay.
Acute or
Chronic.
Acute probably, like for example flu or influenza.
Okay.
Chronic means something dangerous.
Huh?
Something
Danger.
Something
like
dangerous.
cancer.
So chronic and malignant is
Malignant and chronic is
the
same.
same
Yeah.
dangerous.
So you will have to train on the upper part because we still have half an hour. I need you all to train on the upper part. Next class we'll train on all of the
Body.
middle
But
and lower sides
Lower
because
sides.
next class I think we have 2 hours. So
طيب دكتور احنا برضه بناخد الشست we can